So in terms of this particular project, as I say, it's a collaboration between Pavee Point, NCCP and the National Screening Service. And we came together to form a partnership to address the health needs of travellers. And we came together in December 2021 and are continuing our partnership work. In terms of the group we work with, it's roughly 1,000 travellers or 300 families in Finglas and Blanchardstown area who live in a mix of accommodation living. And Pavee Point employ typically 15 traveller primary healthcare workers, and their role really is to do a lot of health initiatives in terms of providing information, signposting and addressing traveller specific health materials. At the bottom there I've just flagged realistically the social determinants of health and health inequalities experienced by travellers, and Patricia and our former speaker went into that in quite a lot of detail, so that's sufficient for now. In terms of the aim, the project set out to better understand the health needs and barriers of the community by addressing cancer prevention, early detection and screening with the traveller population. And we wanted to take a very much a culturally sensitive, community-centred and community-led approach. Ultimately, from doing the project, we wanted to develop and implement tailored training programs with the primary healthcare workers. We wanted to document the barriers and very much bring that back to the National Screening Service and the NCCP. We wanted to develop a lessons learned paper, and we wanted to look at developing tools in order to have sustainability around the project so that we can share the learnings elsewhere around the country. Our approach was very much a multi-component design. So we took a very concrete approach in terms of we delivered educational sessions which were co-created with our primary healthcare workers. We used existing information that was out there, and as you saw there that Bernadette flagged a number of information leaflets. We didn't need to reinvent the wheel in a lot of cases, so we used information that we had, and then we brought our own NSS material, so a lot of easy read information, videos, and we wanted to make it very literacy proof and culturally sensitive. Then when the primary healthcare workers had that information, they went out and did the field work in Finglas and Blanchardstown, and it was there that they met their peers and they talked about risk and detection around cancer and around screening. And ultimately we wanted to get people registered for their screening if they were in the right age category. And then we wanted to find out how this went along. So we had devised some rating scale questionnaires, but we also mostly used our focus groups at the end of the breast, bowel and cervical check to check in with people. How did they find the fieldwork? Did you find those information and tools that you had useful? And did it build any confidence around people to go for registration, or were they registered? And then when we had that information brought back to Pavee Point, we actually discussed, well, were people getting their letters, their results letters? Were they able to read them? Why weren't people turning up to registration, to screening appointments? It's just kind of a busy slide here, but just to give a flavour of the type of resources that we used. NCCP will recognise their own images there. You'll see at the bottom left there, we had our bowel screen kit, and it was mentioned earlier there by Nancy, and that we would have used the kit and showed it to people. In the middle there you see some of our easy read materials, and then at the right there you see one of the resources that was developed by Pavee Point and Mary Keating. So throughout the whole 3 screening projects, it's very hard to talk about all 3 now at the time that we have, but in earnest, what we found was that the primary healthcare workers reported good outreach into the communities and the use of information with multiple people. We achieved a number of people participating in the bowel, breast and cervical screening as a result of the partnership, and a number of barriers were highlighted, already mentioned today. People spoke about literacy issues, poor living conditions, postal difficulties, embarrassment around talking about their health, and the fear around screening very much came through. We prepared a blog which is on our website to talk about the whole experience, and there's just one example of one quote here from a primary healthcare worker. She said, it's about saving lives. It's not just about giving people information now for this project, but they'll always have the information. So these are some images that the girls are going to talk about shortly, and I'll leave that little end. The girls will probably mention as well when they're talking about the images that we wanted to really share today what worked well and what was possibly a challenge. So I know you're going to go into more detail about that, but from what I'm hearing, the educational sessions and the focus groups are really good at giving up-to-date information and allowing the primary healthcare workers to reflect on the existing resources that we have and come up with new ideas about how we can issue information. what was mentioned earlier as well, that the primary healthcare workers really embedded in their community. There's trust there, and people felt comfortable talking to them when they went out to the fieldwork. And I know that Mary might mention later about that emotional challenge that you shared with me, that it's all very well going out and doing the fieldwork and providing information, but when you have to open maybe a results letters with one of your peer and maybe it's not good news, that can be very hard for you as an individual and as a human to relay that kind of messaging. So there's been a number of benefits and outcomes so far with this partnership project. Not only are we building a relationship with our stakeholders and our partners, it's really also showing the great work that's happening out there, building the capacity and knowledge of the primary healthcare workers. Through this work already, we've issued our information on blogs and provided information at conferences, which is fabulous. Next steps is that we're going to collate and report on the 3 cancer screening programmes. We're going to look at how we mainstream that and make it sustainable, and how do we best profile the work. So I'm going to hand you, I don't know how much time we have now, but I'm going to hand you over to Nancy, Mary, Bridget and Helen. 5 minutes, that's great. So they're going to speak. Yeah, they're going to speak to the infographics. I just want to highlight that these were produced to show the process and the results of the project. We thought we wanted to bring back the information to the community in a way that they would like to see it in a visual way.
Well, I'd be one of the ones now that wouldn't have much literacy myself as a primary healthcare worker. So this works very well, say, for my work. So say for the 2 women that would be able to do that little more with literacy, say, or learning. But anyway, we go out, say, our community would be very vulnerable. So say when we go out, learn our education and what we have to do, say, in Pavee Point, when we bring it out to the community, we do our field work, say, it could be 2 or 3 times a week. But when we go out to do something like this, this is where we kind of find time where people is in school, children is in school, and women and men has, suppose, time to talk to us. And we'll try to explain, say, what we need to do with them. So say with the cervical check, we always just advise the women to make sure to have their cervical check. So say bringing the information out and getting them registered, and say tell them how to go to the clinic and what they have to go through. Because we still might even meet some women out there now that still hasn't had a smear test. So do you want to say something?
No, it's just that in this, just to say first of all, to clarify the field work. The field work, we call it, but it means going to the settled houses where there's travellers, going to halting sites. Some are living in fields with no facilities, all that kind of stuff, but it's not just in the fields, we're going to all the travellers. That's the other one. But there was something else I want to say there. Oh yeah, the cervical check, to be quite honest, I'm going to be truthful here. I thought cervical check was a smear test. I didn't know that there was that other bit attached where you go. Like, that's a kind of a different...
Oh, that's, smear test.
Like, well, it's a smear, but it's a bit... There's still a bit more to it that I didn't know.
Yeah.
So, that's that bit. When it came to the intake of people, there was a lot of barriers. Some people already had their own appointments, that was aware of what was happening, but there was other people, for all different reasons, that didn't attend, like the living conditions they were in. There was stuff going on in their lives at that time, and the priority was sorting that out. This wasn't a priority. So there was all that kind of barriers.
And I think what we're trying to say about the cervical check is that's a cervical is a smear test for your cervix. The ovaries, the ovarian was completely different. So through the focus groups, we kind of learned that ourselves as well, because when I'd say I get my smear test, do you know what I mean? But there's different symptoms for the ovarian cancer. So we had to explain that as well when we went out, to keep looking as well for different symptoms to do, because it was 2 different areas, and that the cervical smear didn't check for the ovarian cancer. So for ourselves as well, that was a kind of a learning for ourselves as well in the smear.
Okay.